Welcome to our series, Talks with Docs. I'm Dr. Lisa Peterson, and today I want to talk to you about one of Lincoln's best kept secrets, and that is the Lincoln Family Medicine Program, Residency Program, which is a part of LMEP, Lincoln Medical Educational Partnership. So if I say LMEP, that is what I'm referring to. I think it's one of our best kept secrets, though, as I have been a volunteer faculty there for over 20 years, and I've been so impressed with the residents that are produced there as well as the faculty, and I don't think many people in Lincoln actually know about the program. Today in the studio we have Dr. Veskrna, who is our current interim program director, and Dr. Linsey Haden, who is a current third-year medical resident. So first, Dr. Veskrna, could you please tell us about family medicine, or what family medicine is?
Thank you for inviting us, first of all, Dr. Peterson. Family medicine is about caring for the entire family and caring for every family member across all their life stages. It's about comprehensiveness of care. We deal with every organ system and every disease associated with that, including mental health and emotional disorders. It's about acute care, chronic disease management, disease prevention, and coordination of care. Nowadays our healthcare system is very complicated and often fragmented, and so it's very helpful in many instances for patients to have a physician to help them navigate the complexities of the healthcare system.
And Dr. Haden, you're a third-year resident. Could you just please tell us a little bit about what your education has been up to this point before you started residency?
I received a bachelor's degree from the University of Nebraska, Lincoln. You can get that from any university or college. And then you go to medical school, which
so that was 4 years.
That's usually 4 years, but it could be
more.
Yeah, or if you're accelerated, could be 3, but typically it's 4 to 5. And then medical school, which is a 4-year program. And then after medical school, physicians enter into a residency program. Family medicine is a 3-year program. Some of the other programs are a little bit longer. Just depends on what specialty you go into.
Okay. And you're a DO versus an MD. Can you talk a little bit about the difference there?
There's 2 different types of physicians that are at LMEP and at any residency. They can be a DO or an MD. I'm a DO, which stands for Doctor of Osteopathic Medicine. Our training is very similar to those of MDs, but we also learn some manipulative therapy that can help us in musculoskeletal disorders with some massage therapy, something that's similar to chiropractics, but we have different philosophies with that can help maintain health through different ways.
Okay. And I think as far as testing goes, the tests you take for boards are the same as the MDs. You even have actually extra tests, I think.
Yeah, a lot of times we have extra tests. Boards, I do take the osteopathic boards, except for family medicine. It's all combined. Family medicine boards, it doesn't matter what degree you have. It's the same. But prior to that, you can take the MD boards. Some do, some don't. It just depends. But they're very similar overall, very similar tests.
Okay. And Dr. Veskrna, then could you tell us a little bit about the program itself, the number of residents, the requirements?
We have a total of 24 residents in our program. We have 3 years, first-year residents, second-year residents, and third-year residents, and there's 8 in each class. We actually recruit medical students into our program, and then our program provides specialized training in family medicine for 3 years. We begin their training with assignment to patients, and at the beginning their responsibilities and authority is somewhat limited. We closely supervise their work with experienced physicians, and as they gain in experience and knowledge and skills, they gradually are given more authority and responsibility, and eventually near the end of their training they're capable of seeing patients unsupervised.
Okay. And then with the shortage of family medicine physicians, how many residents come from Nebraska, and then how many stay in Nebraska?
We try to recruit medical students who are from Nebraska, but we try to also recruit people who are just good physicians. In the current year of our residents, 4 of them have ties to Nebraska. The studies have shown that one of the most important factors in determining where a physician practices is where they train. And we've had very good success with getting our graduates of our program to stay in Nebraska. In fact, 72% of our residents have set up practice in Nebraska. 50% are practicing outside of Lincoln and Omaha. Most of those locations are in small community hospitals. And 58 of the family physicians in Lincoln have been graduates of our program. So we try to grow our own physicians.
Yeah, I think that's great for Lincoln. So no, that's why I think it's important that people know about the program. So that's where a lot of our physicians in town have come from. So as far as faculty, how do the faculty interact with 18 residents in the program?
We have 24 residents in our
24.
program.
Oh, okay. Wow, okay, bigger than I thought. So with the 24 residents, how many faculty do you have and how do they interact?
We have 6 full-time family physician faculty, and we have 2 psychologists. One is an adult psychologist and one is a child psychologist. So we integrate behavioral medicine and psychology within our practice. And our first-year residents see patients in our office 2 half-days a week. Our second-year residents see patients 3 half-days, and our third-year residents see patients 4 half-days. When residents begin their training, they're required to present, after they see a patient, they're required to present your patient to an attending physician, and sometimes the attending physician will go into the room and personally examine and confirm all the findings that the resident has obtained. Sometimes they just talk about the management, and if everything sounds good and the residents have a good treatment plan, then the resident returns to the room and finishes up the visit. So initially there is a fair amount of supervision by the faculty physicians, and as the residents progress to their third year, there's less supervision.
Okay, good. And then procedures, both of you can talk about procedures. And what procedures are done at the program that you learn, and do you have to do so many before graduation? And
we do a variety of procedures in our clinic. We do obstetric ultrasounds, we do exercise treadmill tests, we do colposcopy, LEEP procedures, minor surgery procedures, which are often removal of skin lesions. Dr. Haden helped me with colonoscopy training.
The manipulative therapy that I talked about. We do have a room for, since we have lots of DO students available, we all do the manipulative therapy.
Okay. What is the percentage of the DO residents, the MD residents in the program?
It varies by class. Okay. In my class, there's 5 out of 8, and we have a pretty large DO class. Okay. Class below us, there's a couple, and then the class below that, there's not as many.
So I think we've have quite a few DO schools around, and it seems like emphasis has been kind of on primary care, would you say?
That's what they try to do.
School.
Yep.
Yeah, okay. Any other procedures? Did you say vasectomies?
We do vasectomies. Mm-hmm.
Okay.
In the hospital, our residents are trained to do C-sections. They do chest tube insertions, central line insertions, a whole variety of inpatient procedures too.
Okay, good. One thing we know is that for Medicare patients, it's getting harder and harder to find a medical home. And I think it's very interesting to see the continuity of care that they get in the program. And the residents are required, I think, to have so many Medicare patients to follow through. So I thought for anyone out there watching that needs a physician or medical home, the continuity, maybe you can talk a little bit about that.
Well, we really emphasize continuity of care. So if a resident's patient needs to be admitted to the hospital for whatever reason, the resident takes care of them in the hospital. Likewise, when it comes time for a patient to be admitted to a nursing home, our residents see patients in the nursing home. We even do house calls on patients.
Well, and then the first 6 months of training, when they see a Medicare patient, they present the patient to staff.
That's
Maybe
correct.
You can talk a little bit about that.
Every Medicare patient, there are some teaching rules that we have established, and so for Medicare patients, the faculty physician has to personally go in and see each Medicare patient. After the resident's first 6 months of training, then that requirement applies to higher levels, more complex visits. So less complex visits, the resident usually is able to manage them on their own with consultation as needed with the faculty physician.
So really you're getting two heads for the price of one, because you're getting the faculty and the resident, and they're following you. You have that continuity of care, which I think is really important too. So very good. And then obstetrics, again, it's the continuity there, and maybe Linsey would talk a little bit about.
Yeah, we do a lot of obstetrics, and we're always looking for more, of course, in our clinic. But it's great because we can deliver the baby and take care of the baby as well as mom, when we can also take care of the spouse. So we get to know the whole family, and that's just a great feeling to be able to know a whole family when you take care of them. But we do like to focus on obstetrics and are fully capable of taking care of obstetric patients.
And you do your own ultrasounds, stress tests?
For the most part. If things are not looking good or more complex, we always have a great referral base that we can help our patients with. But for the most part, we can manage them in our clinic with ultrasounds there, and we also do non-stress testing there as needed.
Okay, good. And again, that continuity of care and being able to take care of the baby afterwards too. And then the specialists, I know the residents work a lot with the different specialists in the community, so, and you actually are working with them.
Yeah.
So maybe put you on the spot again.
That's okay.
What's your experience there?
I've had a great experience in Lincoln working with all the different specialties around town. And they, for the most part, everybody's very welcoming to us, and they love to teach, and it's just provided a great education for me, definitely. And it also helps our referral base as I go into practice in Lincoln, as I plan to next year. I know my referral base, I know the people that I've worked with, and it's just a great experience from that standpoint.
Do you have any other comments?
There are over 250 volunteer faculty in Lincoln who assist with the training of our residents, and we conservatively estimate that they donate 30,000 to 40,000 hours a year in training our residents, which I think is phenomenal and contributes a lot to the success of our program.
Okay. Well, thank you very much for being here today. And again, now you can see why I thought this was one of our best kept secrets, and I think the staff and the residents are just phenomenal. So if anyone who would like to schedule an appointment at the Lincoln Family Medicine Program, please call 402-483-4571, or you can go online to lfmp.com. Thank you very much, Dr. Veskrna, Dr. Haden, for being with us today. And that's the end of our series today of Talks with Docs. See you again next time.